speaking about building. Thank you. So they will be speaking about building sustainable climate resilience and mental health care systems. My name is Ayomide Olude. I am the project manager at the Anxiety Africa project here at Saucy Vibes, and I will be anchoring our session for today. As you might have noticed, we are recording this session because we will be uploading the session on YouTube, so we can always go back to learn. And about Saucy Vibes briefly, Saucy Vibes is a youth-led organization making sustainability actionable, relatable, and cool for young people in Nigeria. And we've been doing this since 2016. We do this through different areas, through education for sustainable development, through ecofeminism, through community building, advocacy, secularity, and climate and mental health, which is bringing us together today under our training series Anchor. So Anchor is a training series aimed to support mental health professionals in learning more about the connection between climate change and mental health. And we've been running this session since September last year, and this is our sixth and final session. We've gone through understanding climate change and mental health. We've gone through raising awareness of mental health impacts of climate change. We've spoken about climate disaster responses. We've spoken about cultivating disaster responses around climate change and mental health, and also cultivating psychological resilience, both for psychologists, mental health professionals, and also for communities and individuals. And we've also gone through several case studies of climate change and mental health interventions in Africa. We have a website dedicated to this project, and we are going to drop it in the chat box, so you can always go to the website for more information about the project, and to also have access to our past training sessions. Anchor is a collaboration between Saucy Vibes, Daily Education for Clinicians and Telca in Africa, Telca, which is funded by MDoc and Ashoka, and also Project ECHO, which is a virtual support for medical professionals in learning. Please note, Anchor leverages the iEcho model, and we collect registration details, participation details. I'm sure when you registered for this session through Zoom, you got a list of questions, and we are collecting that data, just to understand, demography of people who are joining us to inform our future project. And please be rest assured your data would not be shared with any third party, only between the project partners. And Anchor has been going on for 6 sessions now, and this is our 6th session, and it has been very unique. All through our sessions, we've highlighted these 3 major unique aspects of Anchor. Firstly, it is participants focused. We prioritize participant needs. When we started the project, we had our participants share what they wanted to learn through a needs survey. It's also case-based learning. All through the project, we've had people coming to share real-time experiences of how they've experienced climate change and how it impacts their mental health. And we've also had each session trained by subject matter experts, African subject matter experts, so to speak. So it is for Africans and by Africans, and these are the 3 aspects of the uniqueness of our project. So yeah, we are on key participation tips for the project. Please have your camera on. It makes it very interactive. We know people who are joining and we are able to connect with you virtually, or if you're unable to, that's also fine. If you have any questions, we encourage you to use the chat box, or also raise your hand. And as the facilitator, I will let you speak when it is time to speak. Another thing, like I said, is for you to use the chat functions for any comments or any questions that you have. Most importantly, keep your comments respectful. Everybody's opinion is valid. And if you have any difficulty, kindly drop in the chat box and our tech support will help you. Today we are going through the welcome introduction for our agenda. Then we'll have a pre-quiz session. Then we'll have our first trainer come up, our second trainer come up. And after that, we'll have a question and answer session. And our case presentation is also going to come up where we'll have real-time insight into climate change and mental health conditions on the ground in Africa. After the case presentation, we'll also have a brief time for more comments and more recommendations from both participants and our speakers. And the last thing on our agenda is our post quiz, our reaction survey, and our announcements and wrap up. Right now, we are currently on time for the pre-quiz session. And I'm just going to start the poll. Do let me know if you can see the poll on your screen now. If you can see the poll on your screen, please put a yes in the comment section.
Yeah.
I can't see a yes. Please, can we see the poll? Okay, thank you, Svetlana. Yes, so currently you have a poll on your screen, and the poll consists of 7 questions. And the idea for having this pre-survey poll is to understand where we are at, the knowledge we have before our training session. We'll also have our post survey come up after the trainer session to also understand what we gain. And why we need this is to understand the knowledge gained before and after the session, and this will help us inform research and also thank you. Okay, so this will help us inform research and also gather data on how we are really learning and help inform our future sessions. So I would like for you all to take the poll. If you can't see the survey on your screen, kindly drop a question on the chat box and then we'll help you with it. Yeah, thank you, Ose. So you'll see 3 dots at the end of your screen. Click on it and you will see poll. You should be able to access the poll through that if it's not on the screen. If you have responded to the poll, kindly drop it done in the chat box so I can give you a shout out from the facilitation screen. Thank you, Jennifer. Thank you, Svetlana. I'd like to see more people take the poll, please. There are no penalties for the questions. It's just for us to understand knowledge gain, what we know before the session, and what we gain after the session, which will also inform future projects around learning for mental health professionals. So we are really grateful for people who are taking the poll, and I'm also looking forward to other people on the call taking the poll. If you've done that, please drop it down in the comment section. Also, sharing the responses, the answers to the poll to the post-quiz survey. So kindly wait until then so you can get the correct responses to the question. But like I said, no penalties. We are just trying to understand knowledge gained. What do we know before the session? Are we gaining anything during the training session? Which definitely we are going to learn a lot. Taken from previous sessions that we've had. Thank you, Magali. I'd like to see more Dawn in the comments, please.
Yeah, please. Yeah, please. Okay, yeah, please.
Apologies for going off. We had very heavy rain this morning, so my network has been shaky. Even my backup network is also shaky. But yeah, we are going to pull through. I can see more people are also responding to the polls. I would like to see more responses, please. We'll give it about 2 more minutes and then we'll go to the next part of the training. Kindly put a done in the chat box so I can give you a shout out from my end if you are done. Thank you, Kuda.
Mm.
About 60 more seconds to go. Like I said earlier, there are no, thank you, Olaide. There are no penalties for wrong answers. It is just to test our knowledge. These questions come directly from the trainer's presentation. And it's just for us to understand what do you know before the session and what you learn after the session. There are right and wrong answers, yes, definitely. And we'll be sharing that during the post survey, but there are no penalties for answering wrong or right. We are all learning, and I'm sure why you joined the session is for you to gain more knowledge. What is an eye of knowledge? So thank you all so much for taking the poll. And if you are just joining us, you should see a poll on your screen. We are currently taking a pre-survey for the training. You'll have a bunch of questions related to climate change and mental health and the training today. And we'd just like to gauge our knowledge so far, which will also be coming up in the post-survey. All right, thank you all so much. We are going to end the poll now. Next, I'll be introducing our speakers. All right, thank you. So now I'll be introducing our speakers for today. We have two amazing speakers who are Africans and who have done a lot of work around climate change and mental health in Africa. And they'll be sharing from their wealth of experience today, around our topic on building sustainable mental health systems here in Africa. I'll be reading first from Ethel, who is our first speaker. So Ethel is a training manager at Friendship Bench Zimbabwe. She holds a BSc degree in psychology. She has established herself as a proficient mental health professional with impressive track record. Her expertise lies in database research, where she applies in applying her extensive knowledge of CBT and problem-solving therapy. She's currently serving as training manager at Friendship Branch Program in Zimbabwe. She plays a pivotal role in driving training initiatives aimed at enhancing mental health support for the program. And she took up the role after accumulating over a decade worth of experience in mental health counseling, training, and programming. Our second speaker for today is Rudolph. And Rudolph is a health development and sustainability professional with 20 years of national and international experience working with several organizations in government, INGOs, local NGOs, academia, and other developmental partners. And he has worked around health governance, he has worked around social accountability, sexual and reproductive health for young people, women and socioeconomic empowerment, community participation, and also with local and international organizations. He's currently a PhD candidate at the University of Development Studies in Ghana with technical support from Utrecht University in the Netherlands. And his PhD is focusing on climate, resilience, and sustainable health systems in low resource and subnational settings. So thank you to our trainers so much for being a part of this and accepting to come and share their wealth of knowledge with everyone here today. Right about now, I'll be passing on to Ethel to take the floor. So Ethel, the stage is yours.
Thank you, Oymide. Thank you so much for the background and the great work that you're doing. I'd like to commend you and the organization and forging forward in the fight for this worthy cause. I'd like to say good afternoon to everyone and thank you very much for joining us today. And thank you for joining me for my presentation that I'm about to give to you in a moment. But before I start, I'll start by introducing myself. I'll tell you a short story, a brief background about myself. So my name is Ethel Manda, currently working with Friendship Bench Zimbabwe, intervention that uses stepped care to offer therapy and working with the communities in this country, regionally, as well as globally. As mentioned earlier, my background is in psychology, but I've also held vast experience in research, training, implementation, coordinating programs around mental health at a grassroots level. And the reason why I'm really here is because of the topic that you see on the screen today, the topic that says climate change and mental health, a topic that's really, really important in this day and age that we're living of global warming and climate change. And I'm going to talk briefly about our organization, what we do, where we've come from, talk about the climate change and how it interrelates with mental health, which is the care and services that we give at the Friendship Bench. So before I start, this is a very interesting and exciting topic that I'm going to talk about. And I want to use the training mode that I have adapted over the years of the 10 years and slightly above experience that I've had with Friendship Bench, using simplicity to be able to reach the bigger masses of this world, using language, using explanation that is easy for us to target those people that we call lay when it comes to mental health, so that we demystify the whole mental health topic or subject and make it relevant and easy for people to relate to. So therefore, my training for today is going to try by all means to be simple, straightforward, and easy to relate to each and every person, including the ladies at the marketplace, the people that are in the shopping center, the lawyers, the doctors, and each and every person should not be left behind. This training as well is more like a springboard, just a stepping stone to try and bring out the conversation and try and explore further, try and brainstorm with all the communities around the globe to be able to come out and effectively do work around mental health in relation to the climate change that we're facing. So thank you very much once again. So I'll start off with the Friendship Bench. Briefly, the Friendship Bench provides a sustainable community-based psychological intervention that is evidence-based, accessible, and scalable. Our mission and vision and values at Friendship Bench. Our vision, we want to foresee a Friendship Bench with for all. And this is motivated by our mission to get people out of depression or anxiety and what we call in our local language, kufungisisa. How we want to achieve this and how we're trying to get to this vision that we have is by bridging the gap, by creating safe spaces and a sense of belonging in communities to improve mental health, mental well-being, and enhance quality of life. And this is all guided by our values, which are empathy, connection, and all this is anchored in over a decade of research work that we have done. As you can see in the picture right there, we've got a community bench. That's in the previous slide. We've got a community bench where a grandmother is seated, and this is our lay counselor. So we try by all means to reach out to every corner of the globe, to people that are able to see and assist people that are in need, to connect with people in a cultural appropriate manner, and be able to bring a difference that will bring mental health or mental well-being. So there we have a model of grandmothers that we initially started off working with. These grandmothers are attached to our greatest partner, who's our backbone, and this is the Minister of Health and Childcare in this country. They work there as lay health workers, working in different interventions, and the Friendship Bench is one of the interventions that we found very appropriate for the land, for our grandmothers or grandparents to spearhead. And the bridge that they're closing up here is the mental health specialists who psychologists and psychiatrists, and looking at a population of 15 million people in our country. We have to date 19 psychiatrists, and these are figures from 2022, and 35 clinical psychologists serving the 15 people. And as you are aware that these medical services could actually be quite pricey for the ordinary person to reach, and therefore Friendship Bench created a cost-effective evidence-based, I'll go back to evidence-based, meaning that we use evidence from the research that we make, and we found that this method is something that is working and reaching out to the ordinary person to get free mental health support and services. So I'll start off by describing climate change. According to the United Nations, climate change refers to the long-term shifts in temperatures and weather patterns. These shifts may be natural, but since the 1800s, human activities have been the main driver of climate change, primarily due to the burning of fossil fuels like coal, oil, and gas. And these produce heat-trapping gases. And this is basically the explanation of why our climate is changing and the reason for global warming. And it is very important for us to understand this point of view before we can link it to mental health, which is the next subject that I'm going to describe. So according to the WHO, I think what I would need is the mental health explanation. So maybe whilst we wait for our slide for mental health, I can just give a brief explanation, which is according to the WHO, mental health is a state of well-being in which every individual realizes his or her own potential, is able to cope with stresses of life, can work productively and fruitfully, and is able to contribute to her or his community. So looking at the disruptions that have been brought about by climate change and what we're terming as a mentally healthy individual, which is a person that is able to realize their potential, full potential, is able to have adequate coping mechanism, is able to be productive, is able to be fruitful in life, to be able to serve themselves and be able to serve the community. We have seen a big or huge hindrance that has been brought about by climate change. And examples would be prolonged drought, extreme heat, land degradation, the floods that we experience even in Africa, migration due to these floods and our landscapes being affected, bringing in fear anxiety, including depression. So that relationship, in that explanation, I'm hoping that everyone that's listening now is able to understand, because these are topics that we haven't really tapped into, including Friendship Bench as an organization. We're only beginning to realize the effects that are really drastic on the mental well-being of individuals. So looking at these two the correlations between these two, it brings in the need for conversations like the one that we're having today, of trainings, debates, and workshops, presentations that correlate mental health and climate change. So my first topic for today is basically going to mostly focus on Africa. There's been a lot of talk around global warming on an international level. The Global South, I think, has got a lot of stories to tell that I'm not so sure if those stories have actually really been told. I think it's about time we started really being vocal about what is going on and having proactive minds on how best to handle the situation that arises from the climate changes that we're facing daily. So the impact in Africa that we have seen or realized is increased frequency of disasters. These disasters are disasters that we face in different countries, the cyclones, the excessive heat. And I will try and zone into or bring in the mental health aspect of the disasters that we're facing in Africa and around the world. Stress-related psychiatric disorders, as the term stress is already highlighting that the mindset or the mental health has been compromised. Climate change, which has brought in a lot of these disasters, will indeed affect the psyche or the psychological standing of individuals. Post-traumatic stress disorder is another condition that has come about in the wake of climate change. You have individuals that suffer from flashbacks, just reliving the disasters that they faced. We had a visit where we, in an area in Zimbabwe, in Mutare, which was affected largely by by Cyclone Idai. And as the individual community members relate to that trauma that they faced, they actually relive those incidences as if it is happening at that point. This brings a lot of anxiety. It brings a lot of avoidance and a lot of fear around, the work that they do every day, living in the area that they lived, if they've been moved and are supposed to be moved back in a community that they lived before. There's so much fear and not really wanting to face or talk about the situation that they've been through. And so therefore they're just quietly, internally suffering, which is a big hindrance to an individual's psychological standing. There's also been
Apologies, Ethel.
Yes.
Yeah, I just want to say you have about 5 minutes left. Yes.
Left. Okay, wow. That's great. I'm really enjoying myself, but I'll just quickly talk about the other risks that we have because of climate change. Emotional distress is something that I spoke about. Suicide, apparently, ideation and attempts has been really spoken about during this season that we're in. Farmers that are looking forward to yielding harvests have actually been suffering from depression, and some have actually committed suicide. If we can move over to the next slide. So basically what I have on this screen is something that we're going to share after this presentation. And it's just basically talking about the different psychological issues that individuals face because of the climate change and the difference in weather patterns, etc. Talking about mental health, as a huge advocate for mental health, I have seen the importance of being connected in a community or environment This is something that has given us what we call self-care, has given us the drive to continue because we live in a community with different people. So this, this era of climate change has brought in a lot of migration, and therefore connectedness has been interfered by people migrating to other areas because of altered land settings, which has been brought about by degradation. And so therefore, there's a sense of loneliness that people face. We have eco-anxiety related distress amongst the youth as well. The youth are always going to social media for information. There's so much bombardment of information on social media, which can be really scary and sometimes maybe not relevant and mostly actually not accurate. So it's really brought up youth that are thinking that their future is really doomed. They don't have a future. They don't want to have children. They really feel that there's no need for them to plan for the future because it's doomsday. There's no hope because of all that information that has been brought up through social media and different interventions that come in that are sometimes not legit. So my call is for the role of health workers to intervene and make an impact, because these are the people that come in with information that's legit, information that's clear and concise, information that we can count on. So I would want to advocate for health workers to facilitate the creation of target interventions and strategies in the different communities, and those that are actually really effective could actually be scaled up. The connection of people in communities through counseling, psychosocial initiative. These are initiatives that we've always done, but there's always this element that is always missing because we haven't really considered the impact of climate change on the social standing of our community members. Awareness and campaigns and sensitization should also focus on accurate, relevant information for different community members to be able to understand and be able to plan and come up with grassroots initiatives. My next topic, which is the factors affecting knowledge and preparedness of government and private health institutions, we're saying that it's really not up to governments alone and private institutions. There are a lot of factors that could really be affecting them taking a lead in a more meaningful manner. Research is something that the healthcare workers, governments can be doing to try and understand the effects and how best we can mitigate, how else and how best we can try and avoid our communities, our individuals, our population from getting severe effects from the climate change or from the effects of climate change. There's also the issue of monitoring and evaluation. The data that we have, it needs to be enhanced. Climate action effectiveness has to be really looked into when we're monitoring and evaluating the different programs that we're running. Mobilization also needs to be enhanced. Integration of mental health into psychosocial support for climate initiatives should also be enhanced. Stakeholder engagement, we've got a lot of NGOs that are really supporting the works that the different governments are doing. We need to engage them as healthcare workers. We need to engage them as health institutions, and we need to engage them as governments as well to be able to come together and come up with initiatives that can combat the problems that we're facing at this moment. So basically, that's the presentation that I had for you today. This presentation, as I said earlier, is there to just, bring about or open up a box of discussions, of brainstormings, of ideas and sessions that are similar to the one that we've had today, by bringing in or talking about the nexus between mental health and climate change and how we should all come together as a community and be able to work towards a meaningful cause. Yeah, thank you very much.
Thank you so much, Ethel. That was very insightful, even around your work. And can you hear me?
Yes, I can, clearly.
Okay, yeah. All right. Okay, thank you. I was just, expressing my gratitude around your presentation. But due to the time now, we will move straight over to Rudolph to take over with his presentation, and we'll have time for questions and answer after that. So if you have any questions, kindly drop in the chat box, and we'll make sure to respond to that after the next session. Yeah, over to you.
Yeah, I hope you can all hear me loud and clear.
Clearly.
Is it okay? Okay, thank you very much. I'm very happy to be speaking to all of you. Sosti Vibes. You're doing a great job. Young people are the best. And on this call, I would like to encourage everybody here, especially the young ones, that you need to pick up your future in your own hands. The future belongs to you. You are the future. And I'd like to let you know that my mentor is a young man. He's 35 years. And then he's got so many publications in climate change and health. And then he has led me through this journey. So I am looking forward to seeing all of you in the near future doing amazing things. So basically, I will take a systems approach to this. And then I hear you're all most of you are mental health specialists or practitioners. And hopefully we can learn together. Next slide. Yes, so Ethel has done all the linkages, but what I will try to do is also further echo what she has said. And as you can see from this diagram, before I even get to the diagram, I have a big challenge convincing top academics and then health systems policymakers about the nexus between climate change and health. I've met professors, and then I say, oh, well, I'm working to climate change and health systems. And then suddenly you say, wait, they did that 30 seconds to roll off their head before they come to it. So you can really imagine mental health is something we have not understood very well in Africa. So you can imagine the challenge we all have. But for me, these are opportunities for us. So as you can see from the diagram, once there's increase in global temperatures, we definitely witness climate hazards. And then to my left, you would see that, okay, we'll have increasing frequencies in flood, storms, sea level, drought, heat, wildfires. And then obviously, these would transform somehow through the natural systems or directly into climate-sensitive diseases. And of course, other outcomes which mental health plays a key role. It's something we are living with daily. We see it, but we fail to realize it. Next slide. Yes, so I start by giving you some examples about this. These are three pictures you can see on the screen. First, on my left, you see a beautiful word. I was told it was constructed purposely for coronavirus. And then I think that woman there surely went there to save her life, and suddenly the whole place is flooded. Now, connecting this to mental health, can you imagine if that was your mother or your wife or your auntie or even you yourself? What would have happened to you if you thought of that? And then to the other structures too, you still notice that all these things affect us, but we fail to realize that they affect us, and then we do not have a systematic way of dealing with them. Now, specifically to climate change and mental health, as you would have seen from the quiz already, there are a lot of factors, underlying factors, which we call vulnerability factors that can influence. The slide is moving too fast. Can you go back? Can you go back to the previous slide? No, previous slide. You are going forward. Hello? Yes. So as you can see, there are a number of vulnerability factors. We have the health of a fellow, the socioeconomic status of a fellow, the demographic, your age, your sex, where you live is one thing, and then the political situation is another thing. So all these would kind of excavate your condition, and it leads to possible mental health and psychological outcomes. As you can see, there's a list of them on the right. And then again, the WHO basically recommends that, okay, if we want to build climate resilient health systems. We need to work on 10 components that will make them resilient, and by extension, mental health systems, or health systems that are resilient to climate change. And obviously, these are the building blocks of health systems of leadership, health information systems, medical products, service delivery, and important, of course, financing. We need financing to be able to do that. So this is the basic framework. This takes from a systems perspective, but again, the mental health is a part of health systems. So we need to follow this to be able to realize that. That is a big whole thing. Now, for you to think of is how you can operationalize this, not in Abuja or in Lagos, but in that little state that you find yourself at the subnational level that has all the problems. Next slide. Yes, so I would like to talk about the commitments. There has been a big momentum towards climate change, health systems, and by extension, mental health. I hope you have heard earlier about the ATTACH initiative by the WHO. There has been this global realization that you cannot talk about climate change without health, and by extension, mental health, as you can see. And then again, a lot of African countries, this was as far back as 2023, 26 African countries were committed to this. And then again, I hear the number has gone very high now due to, in the last COP28, there was a whole noise about climate change and health, and by extension, mental health. Now, specifically to Nigeria, you have a commitment of net zero of health systems by 2025. What it means is that you are not just building climate resilient or mental health systems or climate and mental health resilient health systems, but you want to go to net zero. You want to get a situation where your health systems, it's green. You are not producing greenhouse gases, but you are doing it in a sustainable manner and still producing good health. Next. Yes, so I try to touch on policy coordination. I am from Ghana, so I like to use the Ghana example. To my left, you would find that there's the Ghana National Climate Change Master Plan something. You can see health is highlighted. Health is a priority. I just Googled health. I see 441 words come up. Then ironically, I take the Ghana National Health Policy that was developed in 2020. At the time, we had implemented this on the left, and then we thought that, okay, we had integrated everything. And I Googled climate, and you see zero. So clearly, it tells you that there is a disconnect between national agendas and then sector-wide agendas. And I believe the disconnect is even much stronger when you get to the subnational level. So what does this tell us? We need to begin to start thinking outside the box. Otherwise, we are not going to get what we want, especially when mental health for us is something that looks too distant. We are living with it, but we make so many excuses for it. We don't seem to realize it. So as mental health professionals, this is one of the key issues we need to look at, policy coordination. And what is policy coordination? Not just we have the policy formulation cycle, and we have the policy implementation cycle. So even where you are, your local government, how serious are they taking mental health? How serious are they taking climate change? So this is for you to think about it and to see how to go about it. Next slide. Now, we also did a bit of work, and then with subnational health systems, and then we tried to find out, okay, if we want to mainstream climate resilience or climate action into health systems, what are the challenges? And then obviously, we find out that, okay, policy and incentives is number one. First, if you do not, the health systems is heavily regulated. They practice based on policies, protocols, and standards. So if you do not get this into the policy, protocols, and standards of the health systems, they are never going to think of it of an issue. They will feel affected, they will do what they can do, but they cannot do without it. And for mental health, it's the same thing. We need to find a way of doing that. Obviously, there's the whole thing about cost. Yeah, cost is a big issue. Now, even the global financing mechanism, the poorest countries, you take the Green Climate Fund, possibly the loss and damage fund that's coming. We already are not seeing a lot of countries that need more money for adaptation, getting money to adapt. Ask me why. We are not participating in the administration of these funds. You have African funds sitting in Kuala Lumpur. You have a big board that's thinking like we are all at the same level of development. They are not thinking about subnational systems in Africa, and we basically cannot finance it. And the irony is that you do have GIZ or another international NGO that is going to source funds to implement in Africa. And again, I think that we need to demand strongly, whether it's mental health or health systems, to participate in the governance of these funding mechanisms. Now, again, you would notice that health systems or primary healthcare systems run in a particular way. And then again, by the way they run, there's some kind of competition, there's an environment. For example, if a mother dies, it's maternal death. Whether it's in Nigeria or it's in Ghana or it's in Zimbabwe, it's a big issue. Now, it's not even on the agenda. So even the whole ecosystem of health is probably not look like climate resilience. And by extension, I think it's much more serious for mental health, since we are not even seeing it as a big problem ourselves. So it's also another thing that we need to look at. We need to see it as a way of life and has to be discussed. We shouldn't shy away from discussing it, and we need to debate this and make forceful. When you find yourself anywhere, you need to try to establish the need for it and the nexus for it. Next slide. Yes. Now, even now, with mental health, just 2% of government health budgets is spent on mental health, and this is a global average. So you can imagine that in some of the countries that we both come from, we might not even be doing 0.5%. So that is the first challenge, as we already see. How do we overcome this? Others might say, okay, go look for the funding. Where do you look from the funding? We have something we call thick mainstreaming approaches that we got out of our work. And what is this? We are saying that, okay, from the beginning, let's prioritize mental health or climate resilient health systems. How do we prioritize it? Let's put it into our working documents. If you work for a health facility, you work for an NGO, you work for a government health system, and you have the opportunity to draw an annual plan, put in place mental health considerations and take care of climate change. And then once you begin to do this together, then you are able to monitor it. And then for anybody that comes to work with you, NGOs, other people, you ask them, where are your mental health considerations? Where are your climate change and mental health considerations? So for me, that is the way to go. It's the future. We cannot change everything, but you have realized that the concept of climate change and mental health is being framed. It is established, but we are framing, and the fact that the effects are different in different locations. For you as mental health professionals, what you need to do is to begin to actively take mainstream this in everything that you do, beginning from yourself, beginning from where you work, and then whoever you meet, you bring in place your mental health dimensions. For us, that is the way to go. And with time, you would leverage the resources, the evidence to kind of improve national level policy, your subnational policy, and at the end of the day, your international policy, you influence it. So I think that the essence of this is actually bring about the debates, bring about the thinking, but I'd like you to think about that big framework on building climate resilient and low carbon health systems. How possible is it for you to kind of adapt this framework into your work as a government health system, into your work as an NGO? You can put it on the chat box. Later, when we have questions or discussions, we can discuss it and we see how we can implement this from small beginnings, building the evidence and bringing about change. Thank you very much.
Oh, that's super awesome. Thank you so much, Rudolph. Like, I don't want it to end, but then I think, like you both have said, this conversation is just for us to start thinking about it, to start seeing ways in which we can, begin to include this into our work. Some key takeaways I've taken from your session is we as individuals have roles to play, important roles to play. I think that's one thing that's come up for all sessions. As mental health professionals, you have, your role to play in your community. As much as we want a top-down approach, you want the government to create change, like, Ethel said, they also have barriers from that. But now that we have gained knowledge, now that we as mental health professionals now know these things, I think it's up to us with the information we have now to go, like, the question Rudolph have rightly said, how can we include this in our work, whether with the government, whether as an NGO, whether as a private practice? Climate change is going to affect everybody and in various ways. And mental health is something that everybody has. We all have mental health. Definitely, you have a brain, so that is part of it. So how can we, begin to create resilient systems, both from an individual part and even from an health system part? And that is, driving research and all of that. So I think we have one question in the chat. Okay, before that, yes, Abdullah will be sending presentation slides to everyone after the session, so you can always go back to it. We'll also be sending you the recording of the session, so you can always go back to it. I think somebody can drop in the chat our website. On our website, you can get links to all the resources from the session, so you can always visit that and also share that with your colleagues. So the first question we have here, and I think that relates more to Ethel, is from around your work in Friendship Bench, how is it easy or how easy or difficult was it to be able to work with government?
I didn't get the last part of the question.
Yeah, so they asked how easy, or difficult has it been for you working with the government?
All right. Friendship Bench has its greatest support from the Ministry of Health and Childcare Services, as I alluded in my presentation. So from national level, we've got a memorandum of understanding, which then trickles down to the different provinces and the different districts. And there is a strategic plan that was devised for 5 years on incorporating or mainstreaming mental health support within the public health system. So we've been very, very fortunate that way. I must say that research is very important to publish, to rope them in from the beginning, and in the idea stage of programs, because for sustainability, government institutions are usually the best and easier ones to work through, and just roping them in before you even start implementing idea stage and, getting their buy-in is something that has really, really been helpful for Friendship Bench. So I must say that we've been extremely, extremely favorable that way.
Thank you so much. I really resonate with getting their buy-in, although it might be a bit difficult, but
sometimes
going through different strategies to do that. Yeah, it's very important for change-making work. There is also another question.
Very important thing, again, maybe quickly, is that to just recognize the structures in the government system. I think that's what is really important. Don't jump the gun, start from where you're supposed to, and be patient.
Thank you so much. Yeah, so I think this next question is for Rudolph, and after this, I'll just read the comments and then we'll have our case study come up. It says, I have a question about the framework of incorporating climate change and mental health in working documents. This might be challenging when knowledge is lacking. Should this really be the first step for us? I would argue for localized trainings first. Yes, I don't know, Rudolph, if you have anything to say around that.
Yeah, it's true. Capacity is important, but we can spend the whole day discussing this framework. But the framework touches on 6 key health system building blocks. You find that number 1 is the health workforce or human resource for health. That's very important. Because without human resources, nobody's even going to take any climate action within the health systems or mental health action in the context of climate change. So again, you would need to do that. But again, our experience tells us that, look, there is that genuine need for change, even by health professionals. They seem helpless. That is because, okay, the fellow is already overstretched, and then there's workload, and then you come to say, okay, do climate considerations. Most of the time, they won't do it. But once they are bounded by policy, mainstreaming, Ethel talked about mainstreaming. The reason why they made that progress was because government had already mainstreamed this. So for me, I think that it's you take your opportunities. And then usually you would find out that with the health systems, before you touch on one building block, before you realize you are touching, they are kind of integrated. So, but I agree with you that, okay, the health workforce is very important. We need to bring about the debate. But I also do think that the beginning is for us to agree that it exists, and then we integrate it into our health systems policy or our operations or whatever. And like I said, you need to frame it. It takes time to come. It's not that easy. So I think I agree with you as well.
All right, thank you so much for that. We'd love to take other suggestions, but I think we can do that after our case study presentation. Right about now, I'll be calling our case study presenter, Esther Timothy. She's a clinical psychologist with experience working in Nigeria, and she'll be coming up to take us through case study from her personal experience through her work. Over to you, Esther. Esther, you can go ahead, please.
Okay. Thank you very much. Thank you for this opportunity. So please, will you be presenting my slides? Okay. Please confirm if you can hear me well. Sorry, my background is a bit noisy. Can you hear me very well?
Yes, we can hear you.
Okay. My name is Esther Timothy. I'm a clinical psychologist and a mental health expert practicing in Nigeria. So I'll be presenting a case study of a case of climate change which happened last year. It was a flooding incident which actually affected some lives and disturbed some farm produce and foodstuffs of people, and then it also causes mental health stress on the individual that is affected, which I was also a victim. So briefly, I'll just present on the case studies and then the intervention ideas and the outcome of it. Thank you very much. Please, let's go to the slide. Okay, so this is a case of 2023 flood in Abuja, Nigeria, 2023. So the challenges encountered, the strategies I employed, and the overall outcomes at stake. Now, the federal capital territory, Abuja, reported its flood incidents in June 2023. This was not the first flooding. And then on June 23, 2023, heavy rainfall caused flooding in several residential areas in Abuja, including the Sedmore Estate in Lube, Lokokoma Estate, and then Jahiti, where I was affected, and other people. The heavy rainfall lasted for several hours, causing flooding in some parts of the federal capital territory, including Jahiti, Abuja. About 156 houses were flooded, and unfortunately, 4 persons lost their lives due to the incident. Then more than 26 vehicles were swept away in the flooding, and the flood wreaked havoc on the community, destroying foodstuffs and farm produce. Countless homes were left without food because of the flooding incident. Please, next slide. Okay, so this is a case study of a helpless pregnant woman who was affected by the flood as at that June 2023. So there was a case of a couple who were my neighbors in Jahi, Abuja, and their house was affected by the flood, as well as other houses in the neighborhood. Now the wife, whose name was Emily, not the real name though, was pregnant and was helpless at home when the heavy rain started. She couldn't help but watch how the flood soaked the foodstuff they had at home, including 7 bags of rice, which was meant for their shop. Now she was devastated about the whole incident as her husband, who was not around as at when the rain was falling, kept blaming her for letting the rice and other foodstuffs get soaked by the flood. Little did she know that the true tragedy was yet to unfold. And then 2 days after the flood, while still engulfed in a whirlwind of stress and trauma, Emily suffered a miscarriage due to the trauma and the blaming from the husband, the mistreatment from the husband. The physical and emotional toll of the disaster proved too much for her fragile state, and she lost the precious life growing inside of her. So she lost her pregnancy due to the incidents that occurred. So during my intervention, because when this happened, a lot of other people were affected because hers was just a different case. I had to do a personal intervention for her. So during my intervention, she said a personal story of how the flood affected her mentally, triggering underlying symptoms of trauma and depression. So there were already underlying symptoms of trauma and depression. So the flooding was just a trigger which actually caused her a lot of psychological distresses, including suicidal ideation, which I didn't mention on this. Then a few weeks after the incident, the husband sent her packing from the house because the husband actually felt that she should have carried the box of rice from the floor and every other thing. I mean, she was the only person at home, and then you can't even stop the water from coming inside the house. So then the husband didn't understand this, as he was also frustrated and devastated by the whole incident, the cost of her devices that got soaked by the rainwater and the losses he incurred. So he had to send her out of the house and they got separated. Then her husband evacuated the house a month later. So after the initial intervention which I offered her, I kept following up on her mental state, and I was providing psychosocial support services to her. So I had to manage her for a period of 4 months, and then she mentally adjusted. Please, next slide. Okay, so for this flooding, the challenges encountered, there are many more families in this similar situation, helpless and traumatized yearly after flooding. Now, the 2023 flood in Abuja caused significant damage to homes and personal belongings, resulting in the loss and destruction of valuable assets. This was one of the major challenges that was encountered. Also, dealing with the aftermath of a flood was emotionally challenging for victims, causing stress, anxiety, depression, and transfer of aggression, especially in households with families, such as in the case I just presented. This leads to other health challenges, mental health issues, loss of life, displacement, and family separation. So the flood disrupted local economies by damaging businesses and agricultural land, leading to job losses and financial instability. This was another major challenge that was encountered. Then recovering from the flood was a long and challenging process, requiring significant financial resources, time, and community support. As restoring livelihood took months, while some are yet to recover from the trauma. Some people are still struggling with the trauma, and it's only just the June flood access to the same area again. Then the government does not manage the aftermath of the flooding after the incident, and this have a detrimental effect on the citizens. So some of the strategies are employed to cope with the challenges. Please, can you go to the next slide? Okay, thank you. So some of the strategies are employed to cope with these challenges. I provided immediate social support and counseling services to flood victims individually and in groups to help them process their experiences and emotions. Then I also offered psychoeducation about common stress reactions and coping mechanisms to normalize their experiences and provide them with practical tools to manage their mental health. Also, I tie alongside other mental health advocates because I had to get a team with me. We promoted self-care activities such as relaxation techniques, teaching the individuals how to relax, then mindfulness exercises and physical activity to help flood victims reduce stress and improve their overall well-being. We also encourage the development of social support networks through peer-to-peer counseling programs and this promotes a sense of well-being. We also provided accurate information about support services and other resources, and this was done by providing updated information on counseling services and local support networks. So this was introduced to the flood victims for them to be able to access the latest resources and get the necessary help that they require. Then we also implemented a long-term monitoring and follow-up program to assess the ongoing mental health needs of flood victims, provide continued support, and identify any emerging issues or challenges that will arise post-flooding. So this interventions was basically carried out in the area where I was also affected as I was closer to the citizens, and I did require more resources to provide these services to the community. Please, next slide. Okay, yeah. So after the interventions I provided, me alongside my team members, the overall outcome that we achieved, reduction in symptoms of psychological distress, including anxiety, depression, and post-traumatic stress disorder, among flood victims. So they were able to adjust mentally and emotionally, and were able to move on with their life. Also, increase self-confidence and ability to cope with stress, improving overall well-being and resilience. So another outcome was strengthening social support networks where flood victims feel connected, understood, and supported by their peers and the community. And then also, the outcome was minimize long-term psychological impact, with flood victims being able to adapt and recover from the traumatic events more effectively. So these were the outcomes of the interventions that were provided to the affected victims. Thank you very much.
Well, thank you so much, Esther, for sharing your case study. That was very touching and insightful. And we've had people drop comments around the story. So I'm just going to read those comments that we have in the chat, and then I would also give our speakers about 2 minutes to just drop their own comments and observations and recommendations around the case study. So Ose said, yeah, the presentation was very sad, especially about the pregnant woman, and it was heartbreaking. Jennifer says, unfortunately, stories like this show us the need for integrated health systems. A pregnant woman should already be prioritized in times of crisis. Definitely, I agree with that. She also says, I like the integration of health improvement practices to help build personal resilience. Definitely. Magali also said, we had an important episode of floods and landslides in Seychelles in December 2023. Many lost their lives too, and I cannot imagine the trauma that the persons that had to move from their destroyed home or nearly died are suffering. We need to integrate more mental health in disaster and risk management, and especially try and prevent the situations. Reaction is good, but prevention is better and can save so much more. Yeah, so Kuda, apologies if you were struggling to hear. We'll definitely share slides after this via email, and we'll also share the video recording so you can always come back to listen to it. So right now, I'll just give it to our speakers if they can just drop their comments in 60 seconds because our time is going to run out now. Yeah. So Ethel, would you like to go first?
Hello, can you hear me?
Yes, I can hear you now.
Okay, I was actually struggling to hear. I tried to increase my volume here to get to really put or piece the story together. But I was trying to get to also understand from a background. I don't know how much time that you have. You were also trying to share a bit of a background because I couldn't really get the story on my part.
Oh, okay, sorry about that. Can you hear me?
Yes, I can. I can
Yeah,
hear
I was
you.
just asking if you have any recommendations for the story around, what's the old case study, if you have any recommendations or like any insights, maybe around your work, if you've also been
Okay.
able to share psychosocial support with people in communities and how that has worked, and if this also resonates with you. But
So I
I don't know
couldn't
if
really
you
get
can go
to
ahead with that.
understand and piece up the whole story because the volume was really, really low. I tried to increase it on my side, but basically what I managed to pick up was a very traumatizing situation that our speaker was talking about. And just relating to the floods and relating to the disasters that we're facing in Africa and across the globe, I do agree with the participants and listeners that are also talking about prevention being very important. So standing in for mental health care, at Friendship Bench, we're always emphasizing on what we call self-care. Self-care includes the diets that we eat, which is actually very, very easy to access even in our communal areas. How healthy food is very important, how being physically active builds up resilience as far as the psychological standing of human beings is concerned. It's very important to exercise in our different ways. It's very, very important to eat well. And it's also very, very important to get good sleep. I know this day and age, the youth, they're always on the internet. You know, I also have my own children that I have to force to go to bed. But it's important for you to get your 8 hours, you're between 6 and 8 hours, as it builds resistance. It builds resistance in time of turmoil. So it's important to build health for our mental standing before we even get to a place where it's compromised. It's important to build communities that are connecting with each other for them to be able to offer each other support during times of turmoil. We have what we call Circle Kubatana Toset Friendship Bench. It's a circle of individuals that have been through the Friendship Bench intervention and have recovered from anxiety and depressive episodes that meet in communities. On top of trying to build their income base, they also give each other psychosocial support, just meeting and talking about how people are feeling, sharing experiences, etc. So all those mechanisms are mechanisms that could help when we are found to be in need during these difficult times of global warming, is what I can basically share. We have free resources as well on our Friendship Bench website for self-care strategies that people can actually use. You can always reach out to friendshipbench.org and be able to view the different free resources that we have available for the youth, for the adults as well, just to bring or build that resilience. Counseling, very, very important.
Thank you.
For people to seek counseling, for healthcare workers to offer counseling sessions as well. Yeah.
Yeah, thank you so much, Ethel. I would like to pass it on to Woodrow for about like 60 seconds of comment. So thank you.
Yes, thank you. I think that the case study highlights the importance of intersectoral collaboration. I believe in this case, in Nigeria, you would have a meteorological agency that was pretty sure that it was going to rain. You probably had a sub national government that said, okay, they were planning to be sure that they are ready for these eventualities and the rest. And then again, you truly have good mental health professionals. I know Nigerians are good at what they do. So now, can we ask ourselves where the failure was coming from? I think that practically it's just because those who mattered most were not talking to each other. So we are taken by storm. And then even after we have allowed the flood to disseminate everything, we are not even anticipating that people are going to have problems with this. So for me, in our work, or what I learned from this, or what everybody should take away from this, is that it matters. You need to talk to other people that are specialized in other sectors. Because when it comes to issues of climate change and mental health or health systems, it's a broad thing, and it's something that we don't even understand. The effects are localized. So in the case of mental health, maybe I am or you are more resilient than me. So whether there's a flood or not, you don't even care. Another person is not resilient. So for me, the collaboration is important. Evidence building is important. Ethel has a good case. That is good evidence. And I believe that the next time there's a planning somewhere, Ethel goes with this case, obviously people are going to feel sympathy and begin to say, okay, yeah, I think we should think well and the rest. So to cut matters short, whether it's at the federal government level, it's at the sub-national level, or even at your NGO, you should remember that when it comes to issues of climate change, transdisciplinary collaborations are key. And that is where I come to say that, look, unless you see resources to be money, there's always some amount of money available. There's always some amount of technology available to tell that, look, the rains are going to be bad. There's amount of information available to tell that people are going to get post whatever stress after the floods or everything. Can we begin to work as transdisciplinary teams so that we can generate the evidence? And then, you know, there's no way government is just going to take your word that because one person, you know how politicians dismiss people. They say, okay, it's just one person died. But over there, we had a whole school building gone. You know how they think. So it helps us build the evidence, and then it helps us also inform policy, and it helps us bring help where it matters most. So everybody, no one is an island.
You.
No one is an island. Thank you so much. Yeah.
Yeah, thank you so much for that. I think one thing I'm also going to take away is the importance for co-creation and transdisciplinary work, as we have seen. Due to our time, I'm going to launch the post survey right now. And it's just same questions that we had during the pre-survey questions. We've learned a lot, these past few minutes from our trainers and even from case study presentation. And the idea of this post survey is to sort of compare, okay, what do you know before, session started, and what have you gained after the session? And this will also help inform research around trainings like this, and will also help us, share concrete data. Like our speakers have said today, you need research. You need to be able to back up and show your workings, and that is why we are having this survey. So it should have popped up right on your screen. I would encourage you all to if you can see the survey, just put a yes. If you can't, put a no. But if you can't see the survey, you see 3 dots at the bottom of your screen, whether you're using a laptop or a phone. When you click on the dots, it should pop up as you see poll and other options pop up. When you click on poll, the survey should also pop up on the screen. When you are done, kindly put a done in the chat so I can give you a shout out right on stage. Yeah. So if you can see, please let me just see a yes on the screen so I know you can all see it. Can we see the poll, please? I can't see any yes in the chat. Thank you, Ose. Okay, yeah. All right. So please do take your time to answer the questions. Thank you, Magali. Magali is done. Nkosi is done. Kuda is done. Thank you. So it's just for us to understand how much you've learned during our session.
I was thinking there's an entrance, yes, yes, yes. So as I stepped out and I was already called to unmute and speak and it is yes. Good.
Sorry about that. Like I said, there are no penalties for the questions. We just want to know, how much have you learned so far? I have learned a lot during this session. Even though we've been having this, thing last year, new things keep coming up for each session. Now I know like the need for serious co-creation. One agency can't do it, not just mental health professionals can't, work around creating health systems, those climate resilient health systems. And we need everybody to come together to learn about these things. I'd like to see more dons in the chat. We'll give you a few minutes so we can see, so we can have as many people as possible take the survey. If you're having any technical difficulties, do please let us know in the chat. If the survey did not pop on your screen, you see 3 dots at the bottom of your screen. And when you click on the dots, you see poll, and clicking on the poll pop up the survey on your screen. Thank you, Oluwatosin. I'll be sharing the answers to the questions right after this. So please do answer the questions to the best of your abilities. There are no penalties. Yes, there are right or wrong answers, but I think the whole reason why we joined this session is for us to learn from other people and to also increase our knowledge. Like Rudolph rightly says, nobody is an island, and we are all learning together. Thank you, Jennifer. Thank you, Kuda, on your suggestion. Really appropriate. We could go 3 hours, but we also understand, timings for everyone. Please, I would like to see more people take the survey. We'll be wrapping up shortly. If you have any issues in accessing the survey or answering the polls, do let us know in the chat and we can help with that. I'd like to see more dons in the chat. Thank you all for sharing. Thank you to the people who have taken the poll so far. We'll give you a few seconds and then we can end this. Thank you all. Okay, we'll be ending the poll now. And I would read out the answers to the questions that we've had so far. Okay, thank you all for staying and answering the poll. The answer to question 1, which is what is the global average percentage of government expenditure on mental health, and that's 2%. Which is the following underlying factors can impact mental health of a person due to climate change, and that's all of the above. The Alliance for Transformative Action on Climate Change and Health is not an initiative of either World Bank, African Union, or the Pan-American Health Organization. And which of the following is not a possible mental health outcome of climate change, and that's unsecure work? What following actions can mental health workers do to help individuals cope? That is advocating, providing psychoeducation, and developing community support groups. Depression and PTSD increases after climate events, and that is true. And the last question is, which is not a potential barrier for mental health care in the context of climate change? And that's lack of funding for mental health services. I would like to thank all of you for taking the poll, and I hope you've gotten some right answers from the responses I just put out. Now I'll be sharing our reaction survey, and that's just for us to know what you really think about the session, how do you think we can do better, and how do you think the session is going to help you in your work and in the future. And while the poll is up for the reaction survey, I would like to thank you all for staying with us till now. It has been a long journey, 6 months, coming and showing up and learning. And we've had some of you come constantly for all our sessions, and we really appreciate that. I also want to announce that we would be giving out certificates for each individual sessions you've attended. You get a certificate of participation. So if you attend this session, you get a certificate for this. If you've attended our previous sessions, you also get certificates for those. So please watch out for that. Another thing I would also like to share is we would be uploading this video on YouTube, so you can always come back to learn more and also share within your networks and maybe have trainings with your colleagues using our videos. We would also be sharing the session slides to all those who have asked, so please just watch out for emails with more details on the session. I'm deeply grateful to our speakers for also being here, taking their time and sharing from their wealth of knowledge, for us all for the progress of Africans and all of us together, putting our hands together for the good of our communities, basically. I'm deeply grateful, Rudolph and Ethel. Thank you both so much for doing this with us and sharing your knowledge. We really appreciate. If you have any difficulties taking the reaction survey, please let us know, or we'll be rounding up shortly. We've also dropped the link to our website in the chat and our social media pages. So if you'd like to keep up with more of our work, you can follow us at Tip Africa on Instagram, Tip Africa on Twitter, the Eco-Anxiety Africa Project on LinkedIn, and tip.sustivibes.org. That's our website. We'll also get that in the chat. You can go to our website for more resources around this program and all our future and past programs. Thank you all so much. I can see people are still dropping responses on the poll, but we are done, and we are super grateful for you taking your time to be part of this training, and to having you in our future trainings and also getting feedback from you. You can also share emails on whatever you think, and we'll definitely respond to you. Please be expecting the videos, the slides, and your certificates. We'll be sharing an email after the session on further details around those. Thank you all so much. We really appreciate your time, and we are very and super grateful to our speakers and everybody for taking their time to be in this room today. Thank you all so much. We are grateful, and we hope to see you next time. Thank you, thank you, thank you. Goodbye, everyone.
Bye.
Bye-bye.
Yeah.
Thank you so much, Rudolph. Thank you,
Yeah.
Magali. Thank you, Jennifer.
I just put it there, attached. It's a WHO initiative. I don't know whether during the presentation I mentioned it or not, but you just take note.
Oh, all right.
Yeah,
Thank you.
yeah.
Okay, yes. Thank you all.
All right. Bye-bye.
Bye. Thank you all so much. We really appreciate you. Thank you, Okoyemi. This has been very insightful for us too. Bye, everyone.